Substance or drug abuse. Substance abuse, also known as drug abuse, means any misuse or pathological use of medications and drugs, both legal and illegal, as well as alcohol and tobacco, with impairment in social and occupational functioning. The term drug or substance abuse is defined as the use of chemical substances that lead to an increased risk of problems and an inability to control the use of the substance. A substance abuse is a medical condition which interferes with a person's ability to fulfill work, school, or family obligations, person's relationships with family and friends, or in some cases, criminal or antisocial behavior occurs when the person is under the influence of a drug, causing long-term personality changes which results in legal problems and dangerous behavior. Addiction is physiological and psychological dependence on alcohol or other chemical substances that affects the central nervous system in such a way that withdrawal symptoms are experienced when the substance is discontinued. Abuse is a maladaptive or harmful pattern of substance use that impairs health in a broad sense. Dependence refers to certain physical and psychological phenomena induced by the repeated taking of a substance. Dependence on a drug or alcohol tend to have more harmful effects. These effects include mental problems, kidney and liver disease, and injuries from falls. Tolerance. With some drugs, your body needs increasingly higher doses to get the original effect, or you may feel withdrawal symptoms when the drug is stopped. This is referred to as drug tolerance, meaning it is a state in which after repeated administration a drug produces a decreased effect or increasing doses are required to produce the same effect. Withdrawal state, a group of signs and symptoms recurring when a drug is reduced in amount or withdrawn, which last for a limited time. The nature of withdrawal symptoms depend on the use of substance. Commonly used drugs include alcohol, prescription and over-the-counter medications, inhalants and solvents, cannabis, sedatives and hypnotics, benzodiazepines, cocaine, nicotine, opioids, amphetamines and other sympathomimetics. A high prevalence of substance use occurs between the ages of 18 and 24 years. Substance-related disorders are diagnosed more commonly in men than in women. Any use of illegal substances is considered dangerous and therefore abusive. These drugs are potentially addictive or have severe negative health effects. It can also involve using or taking a substance in increasing amounts, going to great lengths to obtain the substance, experiencing withdrawal symptoms when the substance is stopped, or being unable to stop or reduce the use of the substance. Excess use of drugs alter your mood, cloud your judgment, change your perceptions, and all of which can put you in danger of accident and injury. Causes. Biological factors. Sometimes addictions run in families with a strong genetic link. First-degree relatives of alcoholics and monozygotic twins have a higher rate. Biochemical factors. Alcohol may produce morphine-like substances in the brain that are responsible for alcohol addiction. Interpersonal and psychosocial factors. When the parents are self-centered and preoccupied with success and prestige, may lead their children in drug addiction. Socioeconomic factors. Unemployment, overcrowding, urbanization, effects of television and other mass media, occupation. Low socioeconomic status or poverty leads to frustration and then drug addiction. Pharmacological. Some drugs are more likely to cause an addictive effect. Example, opium produces tolerance and physical dependence. Easy availability of certain drugs without prescription. A person's environment such as school, work, friends, family and cultural and religious beliefs can also affect substance use problems. Other mental health conditions such as anxiety and depression may also play a role. Substance use may also start when people try to manage unpleasant feelings and emotions. Example, anger, stress, hopelessness, etc. Consequences of substance abuse. Physical and psychological dependence, unhealthy lifestyles and harmful behaviors, impairment in social and occupational functioning, personal, professional, financial and legal problems, emotional and behavioral problems. Substance abuse during pregnancy jeopardizes fetal well-being. How can I help a loved one who is addicted to drugs? If you think or believe that a family member or close friend is abusing drugs, talk with your healthcare professional and counselor who will refer drug treatment programs for the family member or friend. Many of these programs use outpatient treatment with medications, behavior therapy, supportive and individual psychotherapy. Thank you.